How to use botulinumtoxin to treat Masseter Hypertrophy. Hello everyone, I'm Cesaril. Today I will introduce how to use botulinumtoxin to treat Masseter Hypertrophy. The masseter muscle leaves the jaw, which is important during chewing and can become hypertrophic with repeated chewing, causing a bulge on the outside of the jawline, known as Masseter Hypertrophy. Next is the focus of our video, how to use botulinumtoxin to treat Masseter Hypertrophy. Taking a 100U botulinumtoxin product as an example, we generally use 2.5 ml of normal saline of dilution, which is only our recommended dilution concentration. Let's take a look at the picture on the screen. There are 3 injection points A, B, and C in the picture. Point A is located in the thickest part of the middle of the masseter muscle, and 12U of botulinum toxin is injected. Point B is located about 1 cm above point A along the parallel line of the mandible. Inject 6U of botulinum toxin. Point C is located about 1 cm below point A along the parallel line of the mandible. Inject 6U of botulinum toxin. Take attention, the injection level should be deep muscle layer. Finally, when injecting, ask the client to bite the teeth and insert the needle vertically into the depth of the masseter muscle without touching the periosteum, and let the client relax before injecting again. Please note that if the client's masseter muscle is thin or a small amount of supplemental injection is required, only a small amount of injection can be injected at the most protruding part in the middle, and an appropriate treatment plan should be selected according to the client's situation. Okay, this is today's video. If you have any questions, you can contact me. Bye bye.